In this topic, I will talk about glucagon and the prevention and treatment of hypoglycemia. So what's hypoglycemia is the most common acute complication noted in persons with diabetes. An incidence of at least one severe hypoglycemia event during the past years is noted to be higher in the certain contents. Fear of hypoglycemia may deter the persons with diabetes from reaching glycemic targets. This fear can impact quality of life. So, hypoglycemia is identified as a major barrier to attaining glycemic targets, making it critical to assess frequency of events at each encounter. Classification of hypoglycemia, it has 3 levels. So the level 1 is defined as a glucose less than 70 milligram per deciliter, and level 2 is defined as a glucose less than 54 milligram per deciliter. Level 3 is a severe event characterized by altered mental and physical status requiring assistance for treatment of hypoglycemia. So as we note here in level 3, it has no glucose level. This survey is screened for hypoglycemia for one patient visit you to the clinic. So ask them, what would you like to discuss today? And there are diabetes-related questions. The number of low blood sugar episodes per week, the number of low blood sugar episodes with seizure, passing out, or requiring help from others since the last visit, the number of high blood sugar episodes with the ketone since the last visit. Have you had any emergency room visits or hospital admission since your last visit? Where do you give your shots, abdomen, thighs, buttocks, hip, arms? What prescription do you need today? So glucagon should be prescribed for all individuals at increased risk of level 2 or 3 hypoglycemia. So that's available. Should it be needed? Actually, it's recommended to prescribe it for all patient type 1 diabetes and type 2 insulin requiring. So caregivers, school personnel, or family members of these individuals should know where glucagon is and when and how to administer it. Glucagon administration is not limited to the healthcare professional. So in summary, it is critical to discuss frequency and severity of hypoglycemia at every visit. Persons with diabetes who require insulin therapy should have glucagon readily available. New glucagon formulation have overcome the complexity of prior kits, which require multiple steps. So next, use of mini-dose glucagon may be means to prevent impending hypoglycemia or mitigate exercise-related hypoglycemia. With the advent of a stable liquid glucagon, the potentials for bihormonal closed-loop system will be realized. At the end, I would like to thank you, everybody.